please.
Jebin Singh.
Here.
McGuire.
Here.
McMurtry. Miller.
Here.
Moran.
Here.
Zhang.
Here.
And Ortega.
Aye. Can we stand for the Pledge of Allegiance? I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Land acknowledgement, Commissioner Shung.
Yes, thank you, Mr. Chair. Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes in hope of a better life, and some have lived on this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We are standing on the ancestral lands of the Dakota people. We want to acknowledge the Ojibwe, the Ho-Chunk, and the other nations of people who also call this place home. We pay respects to their elders, past and present. Please take a moment to consider the treaties made by the tribal nations that entitle non-Native people to live and work on traditional Native lands. Consider the many legacies of violence, displacement, migration, and settlement that brings us together here today. And please join us in uncovering such truths at any and all public events. Thank you.
Thank you. I'll entertain a motion on the agenda of April 15th, 2025.
So moved. Second.
Hearing no discussion, roll call, please.
Zhang.
Aye.
Jebin Singh.
Aye.
McGuire.
Aye.
McMurtry. Miller.
Aye.
Moran.
Aye.
And Ortega.
Aye. I'll entertain a motion on the minutes of April 8th, 2025.
So moved.
Second.
Hearing no discussion, roll call.
Zhang.
Aye.
Jebin Singh.
Aye.
McGuire.
Aye.
McMurtry. Miller.
Aye.
Moran. And Ortega.
Aye. We have a proclamation for National Public Safety Telecommunications Week. Commissioner Miller.
Would the telecommunications team like to join me up here? Come on in. All right. Well, it is my honor to present this proclamation this week for National Public Safety Telecommunicators Week proclamation. Ramsey County has the largest emergency communication center in the state of Minnesota. The ECC has over 150 dedicated staff that work 12-hour shifts. ECC processed over 900,000 calls in 2024, and the ECC started their first ever 911 Community Voices, which is a community advisory board. So I'm going to now read the proclamation. Whereas the Ramsey County Emergency Communication Center provides public safety dispatching services for all police and fire departments within Ramsey County, and whereas the Ramsey County Emergency Communication Center is intricately involved with initiatives to secure and dispatch other responders and resources as appropriate for the community served, often pioneering this work. And whereas the Ramsey County Emergency Communications Center's usage of advanced 911, text to 911, and radio technology ensures the prompt response of police officers, firefighters, and medical services within Ramsey County. And whereas the highly trained Ramsey County Emergency Communications Center public safety telecommunicators are the first, often unseen responders who provide crucial services ensuring the safety and well-being of communities through their dedication and professionalism while processing nearly 1 million calls each year. And whereas public safety telecommunicators work tirelessly behind the scenes, often unnoticed by the public, yet the impact they create is felt by every person they assist, every responder they coordinate, and whereas telecommunicators are the single vital link for all responders by monitoring their activities and providing them with up-to-date information. Now, therefore, be it proclaimed, the Ramsey County Board of Commissioners declares April 13th through the 19th, 2025 as Public Safety Telecommunicators Week in Ramsey County, and it be further proclaimed, the Ramsey County Board of Commissioners commends and recognizes the 24 hours a day, 365 days of the year life-saving work and devotion of the employees at the Ramsey County Emergency Communication Center who work to keep Ramsey County and its residents safe. This for you. That works great. We could do introductions, and then we'll do a photo before you guys. And if you want to say a few words, please do.
Sure. Thank you. Thank you, Commissioner. Good morning. I am going to keep my words very brief to say thank you for taking time this week to recognize our professional work that we do. And I have a few staff members here that are willing to not only introduce themselves, but give a few words of why they like to do the work they do. Oh, and I'm sorry, I'm Nancy Pass, the director.
Hi, I'm Sylvia Kennedy. I've been here since August of 2024. Just with my trauma-informed background, I think it was important to work as a telecommunicator. The people, the calls that we get in are, from different backgrounds, and I think with my knowledge and everything, that's why I came over to Ramsey County. Thanks.
Good morning. Thank you for having us. My name's Kelly Patterson. I'm a supervisor at the ECC. I've been there for 23 years. So prior to that, I was a police and fire dispatcher. I think my favorite part of the job is guiding new employees and helping them hone their skills and keeping our partnering agencies safe out in the streets. Thank you.
My name is Victoria Allen, and I've been here since October 2024, and I decided to become a telecommunicator because I wanted to make a more positive impact in my community, and I feel like it's very rewarding being here.
Good morning. My name is Ariana Duran. I'm a telecommunicator as well. I started in August of 24. The job is tough, but I think more than anything, it's rewarding to help people. And it's an honor to be here and accept this proclamation, and it be recognized for what me and my partners do every day. So thank you.
Sorry, I wasn't prepared to speak. My name's Brianne Dunscooter. I've been with the ECC since January of 2022. I love every second of every shift that I've ever worked for the ECC and helping not only the public with getting through their traumatic incidents or their parking complaints or whatever it might be, and also helping our partners dispatching for the St. Paul Police Department. So.
Would you like to introduce yourself?
Sure. Morning, I'm Shar Webby. I've been with the ECC for 15 years, and I'm currently in an administrative role, but started sitting in a telecommunicator seat. And it's a very rewarding career, mostly because of the partners you work with, and you definitely feel the impact you're making in the community.
Hi, Laura Espy. I'm a manager at the ECC. I've been there about 20 years, and I've also sat in every seat there.
Hello, Dan Palmer, Deputy Director, almost 12 years, and I'm just happy to be and proud to be part of this amazing team. So, thank you.
Good morning. My name is Dave Rieger. I'm an emergency communication manager as well over the personnel, so I get the pleasure of working with these amazing people every day and doing what they do. So thank you so much for the recognition. What they go through every day is unpredictable. I mean, from the parking complaints to the traumatic experiences. So thank you so much for the recognition. We really appreciate it.
Did we get everybody? Well, thank you so much for your service. I mean, you are truly the front line when we talk about the front line. And I got to tell you, I've always gotten kudos about your work, so thank you so much. Can we take pictures with the, okay.
Taller people. Good, okay.
Yeah.
The center, yeah, I was looking more to the, yeah. I'll take three, I'll count down to three. 3, 2, 1. 3, 2, 1. One more. 3, 2, 1. Thank you.
Thank you. You know, hold on a minute, I didn't give any of the other commissioners a chance, are we good? Okay. Thank you so much again.
Thank you.
Where is,
Where is your, she's talking.
okay. Let's move on to the administrative agenda.
Thank you, Mr. Chair. I'd like to move item number 4, approval of fees for loss of use and enterprise risk management administrative overhead during subrogation of claims. Item number 5, agreement with Hennepin County for CEO Now Business Institute programming. That's it.
Second that.
Any discussion? Roll call.
Zhang,
Aye.
Jebin Singh, McGuire, McMurtry,
Aye.
Miller,
Aye.
Moran,
Aye.
and Ortega.
Aye. Now we have the opiate response initiative update.
Director Amy Karen's going to do that update for us. Thank you, Mr. Chair.
Good morning, Mr. Chair, Commissioners, County Manager. Thanks for having me here today. Again, you saw me last week.
I was about to say, we've kept you busy since you come on board. You're here almost every week.
So today I'm here to give you an update on our opioid response initiative. So as you know, there's an opioid epidemic, which has been going on for quite some time and has been declared as a national public health crisis. So the number one cause of accidental deaths in U.S. are due to drug overdoses, with opioids topping the list of those drugs. So some of the drugs that are included in the opioid class are both illegal and legal prescribed drugs. So one of the illegals would be heroin, and synthetic opioids such as fentanyl, which I'm sure you've been hearing a lot about recently, and pain relievers, and then prescriptions such as oxycodone and Vicodin, morphine, some of those drug types. So the data I'm going to give you today is through 2023. That's the most recent that we have right now. So there's a lag. So after a period of substantial increases in fatal drug overdoses in the United States for many decades, 2022 and 2023 saw a decline, and the decline seems to be continuing, which is good. The Centers for Disease Control and Prevention, as of October 2024, indicated a decline of about 12.71% for a 12-month period ending in May of 2024. So this held true, as you can see on this graph, for Ramsey County. The number of non-fatal, this shows fatal drug overdoses, the number of non-fatal overdoses for all opioids grew between 2016 and 2021 in Minnesota. So this one shows fatal overdose deaths from 2014 to 2023. So as I said, about 75% of all the drug overdose deaths in Ramsey County involve opioids. So while these deaths have are declining, we are still obviously being impacted by opioid use. So my next slide here is diagnosed opioid conditions among Minnesotans. So we have a new data system here in Minnesota within the last couple of years called HTEC. It's Health Trends Across Counties. And this is a collaboration between health systems, 11 of the health systems, public health departments, health organizations, and some of our health plans. And the data that we're pulling off this system is from the electronic health records. We don't get, obviously, personalized information, but we get, like, aggregated data. So this is about 90% of the healthcare for Minnesotans that it shows. So prevalence for this health condition seen in our health system in the last 3 years, and they also, they were seen in the last 3 years, but had opioid use in the last 5 years. So that's a little confusing, but, and some of those conditions include opioid overdoses, accidental or intentional.
No, I'm going to let you finish, and I want Garrison needs to ask a question.
Oh, okay, yes.
Thank you, Mr. Chair. I had a really quick question on slide number 3 with the fatal drug overdoses. When you dig into the data and disaggregate the data, do you have any specifics around whether that decline was seen across all demographics of residents? Just knowing that there is, you speak to the 16.5 decrease, was that across?
Yeah, that's a really good question. I don't have that here with me today, but we do know that American Indians and our people of color or blacks tend to be dominant with these fatal drug overdoses. I don't have the exact statistics, but I can get those for you. And for sure, that HTEC system, that does drill down to different populations and age groups. And I'll go over here in a little bit. A little surprising what our top age groups are. It's not what you think. So this also came off of HTEC, so you can, if you're interested, you can go in on the website and do different filters within this data portal. So as I said, this is just a visual of those residents in Ramsey County that came into the health system in the last 3 years and had a diagnosis of opioid use in the last 5 years. So here, this is what you were asking about a little bit. So American Indian population, males, and residents who are 55 to 64 years old. So that might be a little bit of a surprising statistic for people with that age range. And then you can see where it's concentrated within our county.
Can I ask a question?
Excuse me, Commissioner Miller.
Can I ask a follow-up question on that? Do we know if it's new, if they're new users, or like maybe relapse, or are they already on an opioid medication and receiving assistance from a doctor?
I am not sure if this system can tell, if this data system lets us, get that specific, but I will check into that and let you know.
Excuse me, Commissioner Moran.
Hi. Could you share a little bit more around the data around that age of 55, 64? Where did that data information come from? Because I see a lot of young people who are really experiencing the use of opioids, fentanyl.
Well, what we don't have, there is a gap in data, which there always is, but one of the gaps we have is if people haven't touched, a point with a health system, a clinic, or with us that would be in that data system, we wouldn't have that information on them. So as you can imagine, yeah, there's a huge gap there with our young adult population. And I'm sure it's a much larger problem than what any of our data is showing. So that's a really good point.
Yeah.
Okay, so our opioid settlement funds, As you know, back in 2021, our Minnesota Attorney General's office joined a historic multi-state settlement agreements with our pharmaceutical distributors and opioid manufacturers. So the parties to these settlements are states, cities, and counties. We reached an agreement here in Minnesota with how the funds were going to get distributed across Minnesota. So 75% went to counties and cities, and 25% are going to the state. So here in Ramsey County, we will bring in over $26 million on just this settlement. And so as of February, the end of February this year, we've received about $8.8 million of these dollars. We have 13 more years to go. So while the $26 million sounds like a lot, it's spread out over quite a long time period. Our next round of funds we're supposed to get in July of this year, and that will be right around $1.5 million. And then just recently, within this last week, I don't have the numbers yet on it, but another case was settled where we should, here in Minnesota, get upwards of about $10 million. So spread out across the state.
Excuse me, Commissioner Singh?
Yes, I had a constituent who had a real question around, as these settlements are coming through and going to the different entities like Ramsey County and public health initiatives and things like that, are there any dollars that are available for individuals or families to help relieve the medical debt that they ensued getting treated for substance abuse disorder and things like that? I mean, there is hope for recovery, and it often comes with financial complications. Do you know of anywhere where these settlement dollars are available for individuals or families?
Well, what we hope to do, we did a first round of funding for community grants last year. Those just wrapped up at the end of February, so we're getting the reports back in from those entities that we gave dollars to that are working directly with our residents. We also work directly with our residents through our clinical services. But you're saying like dollars going directly to an individual. We have not done that. However, we are going to keep doing harm reduction services, syringe exchange, Narcan, those type of things. But that is certainly something we can look into. Mm-hmm.
Thank you.
So I just really wanted, it's really important to mention that we utilize additional funds from other sources, and we braid this funding throughout the different activities that we're doing out there. So I just wanted to mention a few of these. So in 2023, Ramsey County was awarded just under $500,000 per year for 5 years from the Substance Abuse and Mental Health Services Administration. That is federal funding. And then we were also awarded $1.2 million that will go from November of 23 through June of 26. And that is from Department of Human Services with the Opioid Epidemic Response Advisory Council. And that's to really implement a harm reduction and treatment connection project that aims to expand community access to harm reduction services, treatments, and referrals. So a little bit about what you're talking about, but not specifically like a health insurance plan for people. But so specifically, this project works with justice-involved individuals, people experiencing homelessness, and ethnic communities disproportionately impacted by the opioid use disorder, including African American and American Indian communities, and those that are a resident within our correctional facilities, and then also those that we have with our syringe service program through Clinic 555. So our commitment with our opioid response initiative is to really listen to our community members and again, drill down to those populations that are being affected the most, so that, with limited resources, that we make sure that we're touching those populations. That would be our top priority. And then making data-driven decisions with the data that we do have, and then educating and informing the community about the impact of opioids. So it's not just the people using there's ripple effects across our communities.
Excuse me, Commissioner Moran.
So I see in your presentation here you talk about data-driven decision-making that will save lives. And I also noticed back in a few slides back you talked about the opioid deaths decrease by 16.5%. And I think maybe, I don't know, that is because of Narcans and that it has been readily available to people who are overdosing. So we're seeing less death, but we are seeing a continuation of the disease. And so have there been any conversation about getting people off of opioids through the Suboxone maintenance program and to expand that beyond the jails?
We definitely have talked about that. There's a short-term, as you probably know, there's like a short-term medication you could give with Suboxone that kind of helps people through the first 24 hours. And we're looking at the medication actually that's more long-term. That would be for 30 days. I think we could make a really huge impact with that. So we're studying that and kind of looking at that to see if we might actually buy up some of that medication and try to distribute that out to people.
I'd like to follow up on that. 2 years ago, I had a meeting. I was at a meeting. I think, Rena, you were there too. I could, I'm
On
almost
that
sure.
program?
We met with Minneapolis, Hennepin County,
Yes.
and Ramsey, and we talked about this very issue. And the hope was, and I don't know, I guess I'm asking for some type of status report, that we would get together, because Minneapolis was moving on, looking at the very issue Rena is raising, which is, how do we start treating these folks that are overdosing, basically? It's almost reaching epidemic proportions. What happened to those? Are we connecting with our folks around the metro area? Are we sharing best practices? Or what are they doing that we're not? The hope was to get on the same page.
Yeah, and I'll admit there's been a little bit of a lag here. We have not had a coordinator within public health since I've been here, and the goal is we should have somebody in place in May to kind of take up this work, and we're kind of doing like a refresh on this work. Like I said, we did those community grants this past year and kind of evaluating those, and we do need to make better connections or reconnect with those. There are some statewide meetings that the Department of Health or Department of Human Services holds that we are a part of through that ORAC grant. So we are hearing what some people are doing like across the state and within the metro area, but I'll agree we need to have much stronger partnerships with that.
Are we still using Narcan? With people?
Yes.
So we have not moved off that. I mean, we're still, the problem with Narcan is that the moment you use it, you sort of putting you're putting the individual into cold turkey, so they're going to rush out and do it all over again.
And that's where we need to start exploring that Suboxone a little bit more in the long term.
But this is 2 years ago we were talking about this.
Right.
And while it became an issue because it was affecting a lot of homeless people, and so it was visible, I think to the point of both Garrison and Rena, the issue is that we have a lot of our people of color, quite frankly, who are using this, and they're younger. Maybe they're not out in the street overdosing, but I don't think the issue has gotten any better. So I'm trying to get a handle. The meetings are fine, but meetings become worthless, in my opinion, after you've been at it for 2 years. I guess, where are we moving? How is this? What is Minneapolis doing? Are they doing anything different than we are?
They are doing some different things. One example I can give you is they have a vending machine, or a couple of vending machines that hold Narcan out in the community for people to just, it's free. They can go in and get that, no questions asked. That's a good example of, something that we want to maybe implement here. Yeah, so we are keeping an eye on that, but you are right. Like I said, we're kind of doing a refresh right now, and, we need to hit the ground running here.
Garrison?
Thank you, Mr. Chair. And you mentioned the Minneapolis piece of the vending machine. I know last year I had a chance to visit the Scott County Sheriff's Department. They have something similar where kind of in their lobby for their department, they have a similar, just a box where folks can readily come in and get Narcan. But on the point of the Sheriff's Department in particular, what is the relationship with the Sheriff's Department, the collaboration look like? Just understanding, I had a chance to last week go and visit the ADC and to meet with the sheriffs and a couple of deputies, and they spoke to, the overwhelming nature of having folks who are grappling with substance use, specifically opioids, and it being an area where, they may not be really that equipped to handle. There's additional resources and programs that we should be utilizing to ensure these folks are getting the help they need, and not specifically on the backs of our sheriff's department. So I would love to get a better sense of what the collaboration currently looks like, and if there are discussions to improve or figure out ways that we can make sure that both the work that you're doing and the work of the Sheriff's Department are kind of working in tandem.
Yeah, so we do have a good partnership with the Sheriff's Office, but could be stronger. One of the ways that we're partnering with them is through our correctional health within our facilities. Outside of that, what you're kind of talking about, like the response, one of the initiatives that we have is the Appropriate Response Initiative, where we do have a couple of public health responders that go out to calls that aren't overdose calls, but like people that are addicted, and trying to get them hooked into the various resources that could help them come off of their opioid addictions. So.
No, one more thing, and I'm glad you mentioned appropriate response, and correct me if I'm wrong, that's specific to, so the city of St. Paul is not a part of the appropriate response initiative, correct? Okay.
No, but we most recently had a tabletop exercise with them, and trying to figure out how we can better work with them, especially with the small amount of resources we have. It's really important now to join together and make the biggest impact that we can.
Mm-hmm.
So.
Commissioner Sin?
Yeah, I just want to say that as a community mental health provider, prior to being here, being in collaborative spaces, that the public health initiatives that we're getting, Narcan, and the education and awareness around treatment options I saw it in community being distributed through our trusted cultural partners and different messengers. So not to say that that's just the beginning, but it was lovely to see that from the inside, the different community partners who were holding, online focus groups and different kinds of things in multiple languages, and attending some of those community outreach events. So the work is happening with a number of our community providers, and some of that is partnership with what you're doing. So I appreciate that. And one of the things I'm thinking about is that substance abuse disorder throughout history, especially here in this country, has impacted different communities in disparate ways. Different drugs have had different reactions from our criminal justice system, from our public health systems, from our medical systems, public opinion and empathy, for all sorts of systemic reasons. And I guess the question I have is, my concern, I know these dollars come from the opioid settlements, but is there flexibility in the work that we're doing to address substance abuse disorders at large and all of the forms that they come in? Because we know that as soon as this epidemic goes by, there will be yet another one on its heels, and I would hate to think that the face of the people who are impacted will determine our reaction, because all folks need the help that they need. I'm just curious if we have the ability in these actions to be thinking broader than just opioid use.
That's a really good question and a really good point. You are right. So like once this epidemic is kind of over, you're right, there will be some new drug to kind of fill in, unfortunately. These are really specific to opioids. And we did sign, I'm just going to advance my slides here. We did sign a MOU with the state, and I have that further on here in my presentation, but there's specific categories that we have to follow and report on each year. But of course, we're looking at creative ways to kind of, as you know, a lot of people are polydrug users, have mental health illness, those kind of things. So to really look at this holistically is important too, and not just opioids. So hoping to catch some of those things through our response and our actions with this. Yeah.
Lee?
Yeah, thank you, Mr. Chair. I was just going to kind of sum up a couple of takeaways that I'm getting from this before we move into these priority areas. I know we're trying to get a new opioid coordinator. Amy, I would just encourage you to continue to work with the metro area public health directors and really lift up this conversation at a more strategic level and understand that. And I'd love to connect with you and talk further about how we can be a partner at those tables as the Ramsey County St. Paul Public Health. And then in terms of the connection to the sheriff's office, I think this is a little bit of the breaking down of the silos when I talk about One Ramsey County. I know Deputy County Manager Reyes has been working more closely with Amy, particularly around ARI, but I think this a combination of like kind of resetting how we deal with substance abuse in the community on a broader scale with all partners in terms of internal to the county first and foremost, and then with external partners needs to come back to this board before the end of the year with like a kind of a plan of sorts and how we work together around this. And so if the board's agreeable, those are a couple of takeaways I'll make sure we follow up on. So thank you.
Oh, thank you. I'll continue along here. So some of the priority areas, I won't go through each of these, but you can see our pregnant and parenting women and babies, culturally specific approaches, which I've already kind of outlined a little bit, our health education awareness and outreach, and then treatment and support for people involved in the justice system. But you've made a good point too, like how do we expand that out into the communities when people aren't touching our justice system? And then education and engagement with young people. Okay, so you did mention our community groups. We had an internal kind of pilot project for naloxone training for our own staff that we made available. And since 2022, we provided 70 trainings to approximately 1,200 staff here in Ramsey County. So those are 1,200 people carrying around Narcan and able to just administer that to people that are going into overdose. We did distribute kind of a pocket guide to go along with that. And then the community naloxone distribution program, this was also a pilot, so we're going to take a look at this and see how that went. Mr. Chair, you mentioned that this program also. So like I said, we're kind of at this crossroads where we kind of need to look back at what we've done and then refresh things and see how we can both, effectively move forward. So priority populations for this were obviously Ramsey County residents, and then people who use drugs, and those who work, live, and associate with people who use drugs, and then communities with disproportionate overdoses, all marginalized communities. So that was the focus. Hopefully you've heard about our Clinic 555 Caravan. Our opioid settlement funds did not pay for this, but the ORAC funds did through the Department of Human Services. So this has been up and running just recently, within the last year. And it doesn't only focus on opioid type services, it's harm reduction services like syringe exchange, doing some on-site testing for people of infectious disease, and other things that that they're able to do kind of on the spot, and then referring people to mental health treatment, those type of things with the resources that they need. And so this van has been around a few different community spots. Communities can request from us to come to an event or to a specific place in the community on certain dates and times and things, and we can do that.
Excuse me, Commissioner Sean, and then Garris.
Yeah, for for this, what is your goal in utilizing this or being out in the community?
Well, I have said for the last 25 years being in public health, it's great when we have, build programs, but oftentimes we expect the public to come to us, and this is really coming to them. We need to do a better job of doing that, reaching our residents right where they're at, instead of expecting them to come into us all the time. Mm-hmm. So that's the main goal, is to reach more people, reach some of those populations that I've described that are disproportionately affected by this.
And are you out like weekly or just like a few times a week, or are there like
more so
locations
winter
you go consistently?
obviously kind of sits in the winter, but spring now and summer, we are open to go to any kind of event, like I said, or community gatherings, places like that where people will request us. So we just started this, so we haven't been out a lot, but hopefully more now this summer.
Okay, and then my other question is just, is there partnership between the cities about like where homeless encampments may be to utilize this?
That's a great question. I am actually going out next week with our homeless action team. Gloria Reyes hooked me up with that just to kind of see what's happening along our green line and our corridors. So that'll be, I want to see it for myself and see how we can partner better. I realize that we've done some partnership in the past, but as you've mentioned, those partnerships need to be stronger, and we need to really work on that.
Yeah, I would just adding on to what County Manager Becker said about like the coordination is just a stronger coordination with City of St. Paul too. I know that they're getting their own allocation too, but it would be a missed opportunity if we didn't talk to each other about how we're pulling those resources together and coordinating, because we are technically St. Paul Ramsey County Public Health. Yeah.
That is right.
Thank you.
Thank you.
In regards to the caravan, what is the process for residents to make their request? How is it marketed? Because I've heard from a few constituents who have wanted to have the caravan and just wanted to understand the process to go about requesting for it to come to their neighborhood.
Yeah, and I don't have that link here, but there is a way to do that online, or please feel free they can contact me directly too, and I can get them to the right people.
Awesome.
It is through our Clinic 555, so.
Great. And my other question is, when you're all looking at, community engagement and the partnerships, are there different partners that you all have not utilized in the past that you've now kind of reevaluated and said this is probably an organization or a group that we should engage more? And the reason why I ask is that I'm thinking specifically of a number of our faith-based groups, churches, synagogues, mosques. These are institutions that have a lot of built-in credibility and trust within the folks who are there, and so kind of leveraging that to go about doing this work and educating folks and hopefully growing that partnership. But just wanted to see if there are any other groups that have come to mind that you all have not previously been engaged with that you'd like to in the coming years.
Yeah, I'll just say personally myself, I've only been here 4 months, but I am learning really quickly that there are some really great community groups out there. And I've had some personal interaction with some of these groups that I really think we kind of missed the boat the last couple of years of not partnering with them. I mentioned those community grants that we put out. We really need to revise how we do that. Those grants were very small. They were about up to $40,000 for a year, which is not a whole lot of dollars to address this. So really looking at how we can get those dollars out into the community and then partner with those community groups, but obviously beyond that too. So I can just tell you, like, as far as we're just kind of entering in some of those conversations with some newer groups. But if you all have groups that you think you just mentioned some of our faith-based organizations, we're open for suggestions. So please. Yep, go ahead.
No, I have Rena first and then Miller.
I think you spoke to one of my questions around the small amounts of dollars you're giving to community organizations to do the work. You know, if we want to have an impact, we got to really help community to have an impact, right?
Yeah.
And so I'm glad you're thinking about rethinking that process. What is the criteria or the qualifications or, expectations that you're having, with the population that are most impacted by this epidemic that we're seeing right now? Just for like a little bit more around that grant process and what that looks like. And as you think about this further and how we move to have a greater impact.
Right, and we did decide to kind of hold off on those grants, but we hope to distribute some kind of grants before the end of the year. And I think we're really at a point where we need to do some major strategic planning right now. And like I said, assess what we did kind of the last year or two and improve on that. But that's exactly right. We were looking at the 40,000 is just, you can't hardly do anything with that, so.
I have Commissioner Zhang, then Miller.
Thank you, Mr. Chair. I have a question about this. I'm glad to hear that you recognize that 1 year time period is short and the amount. Are you considering like a two-year grants or multi-year grants at the moment, or are you waiting to get more input from previous grantees?
I think getting input from previous grantees, but also what the community wants too. And so if you're hearing things, suggestions on how we can do that better, please send that my way.
And then my next question is, are these reimbursement based, meaning that the organization has to spend money first and then submit receipts for reimbursement?
Yeah, yes. And so I get where you're coming from. Like, our small organizations can't necessarily handle that. So that's something, we can look at all those things.
Okay,
really
great.
revamp that.
Glad to hear that. Thank you.
Okay, I just wanted to mention a few things. You mentioned community groups and reaching out to different groups. I know a few, but I also want to encourage you to also look at internal groups as well. There are a lot of great advisory committees and community groups that are going on in different departments within the county that would be really great to reach out to, because a lot of times they have connections in community as well. And I kind of just want to echo what Commissioner Moran and Commissioner Zhang said about the time frame and the funding. I remember when these groups came out, coming from the nonprofit sector, and our organization, who has deep roots in community, and one of the communities that has the high disparities, declined to apply because it was not worth the effort for a short term, and it really kind of limits the organizations that you will get. They either have to have a specific role in this work rather than other organizations that are maybe doing different type of work but still have that large reach. So I look forward to seeing the results from this grant round, and also seeing how the next one rolls out.
Yeah, thank you for that.
Commissioner Moran?
And I do remember in another slide, you talk about research and data, to be research and data informed. So research and data tells us that you need at least 3 years of funding to even begin to have an impact on the crisis that we're seeing in our community. So I would just say continue to look at what research and data is telling us and try to apply that to the processes that you have in place. Because it does no good to give $40,000 to one organization 1 year and then go on to the next one. And then it's penny and diming, and that doesn't make no sense.
Mary Jo?
Thank you, Mr. Chair. Thank you so much. I appreciate all your work in coming into this and pulling it all together. We had an opioid coordinator, but they're no longer with us, and now we're hiring a new one. Is that we have one person that sort of coordinates all this?
The goal is to have one in place here in May. So
by May, did you say?
Yes, we're really close.
Okay,
yes.
So that'll be really great. So they can work on this, all of these efforts. I'm glad for that. And I wanted just to follow up on a question that Commissioner Zhang had asked about, the caravan, which we love, and I'm excited that we're going out to the people. We all think that's a great idea. And so if people want to have the caravan at their events, how do they go about doing this? Because we've got people watching us now. So how do they go about, because I'm guessing from what you've said that it's not on a schedule. It's just going to be on an as requested basis to go out to community, and maybe you'll find some places that really do need you on a regular basis, but right now it's new, and so it's as scheduled. So how do people schedule it?
So to go, you can go through, as I mentioned, through our website online to schedule that. Okay. You can also call us at our number, which I don't have here right now. Okay. Or please contact me too. And you know, some of the examples where we've been is like St. Paul Pride, Twin Cities Pride, Clues, Annika Foundation, and Rainbow Health. So you know, those are just a few that we've done this last year, or past summer, really.
Thank you.
Yeah.
I just want to just remind, just kind of put this discussion in our current funding context, because we have just had a really lovely conversation of how we can improve the work we're doing here in Ramsey County through your endeavors. But I just want to remind us that Medicaid is the #1 source of substance abuse disorder funding for treatment in our state. That those cuts are pending. The idea that the state has in both the House and the Senate budgets has slated to cut substance abuse disorder funds and a cost share to shift costs to counties for these treatment centers, for these treatment things. So the idea of what we want to do versus what we'll have resources to do is devastatingly different. The gap between what we know needs to be done and what we'll have the resources to do is mind-numbing to me, quite honestly. I think where we put our dollars reflects our values, and I think that the budgets that we're seeing at the state and federal level, I'm sorry, I'm going to be harsh, but are ready to throw people away. And it's going to put some really tough decisions on us as a county as to how we prioritize how we address these issues and support our residents. And so I just want to say that out loud, as we have just encouraged you to go off and do this work, knowing that we don't know exactly what's going to happen in the next months and years that will put barriers to your team being able to do this work with fidelity. And I guess one of the questions I have, I know the next couple of slides are talking about the timeline for these grants out into community. And by the way, these cuts aren't only affecting us at Ramsey County, they're going to be affecting all of our community-based providers and healthcare and treatment centers as well. And I guess my question is are these funds for these grants dollars we already have, or are these from the settlement dollars, or is there anything from any of those pockets that I just, threw out there is potentially drying up? I'm just curious, like, as far as what we're talking about today, what funds we already have secured and what are hope to have funds versus we already have funds.
Well, the opioid resettlement funds, that's through lawsuits, so those cannot be taken away from us. Those are solid. And as I mentioned, we have 13 more years of that spread out. The ORAC grant, that's also from settlement funds that went to Department of Human Services that we have funds through 2026, a little bit smaller amount of dollars. And then I mentioned SAMHSA, and that's federal funding, and so that's a little shakier.
Yep. Thank you.
Okay,
we're good.
You good?
Yep.
Okay, I am going to move on here. We talked about
one last,
yes.
we have great community partnership with community organizations, and we built that over the years. That was intentional for Ramsey County. Rather than doing everything ourselves, we decided we needed, but we had to build that capacity. So if I go back 40 years and look at our community clinics, they were nothing compared to the type of service they deliver now. I mean, not even close. That took a long time. By the same token, we rely a lot on the culturally specific organizations to address some of these. but do we have an assessment of what their capacity is? I'll give you an example. I mean, we're talking about chemical dependency, and I've worked in this field, and that takes expertise. And it takes, skill sets that we have to nourish in the communities, but culturally specifically. So before we just go, just putting names on the board to saying they do the, I mean, the reality is that they all don't have the same capacity or even any capacity to handle some of these issues. Have we been doing, well, you just got here, but we need to start thinking about how do we go back, just like we did with the community health clinics. How do we help them build capacities? And we need partnerships for that too. That was not done just by Ramsey County. We had to team up with hospitals, we had to team up with schools, universities. So I'm just throwing that out because I think we need to keep an eye on that too.
Yeah, absolutely. And I think, as Commissioner Jebin Singh said, I think it's going to get tougher and tougher out there as our federal funds kind of shrink and some of those grants shrink, and we're going to have more, it's going to affect the community groups, which will obviously put more pressure on us as a county. So,
and I understand that. It's not the first time that we had to deal with federal cuts. It's happened many times. But we don't even have, we need to make an assessment of what those needs are for the organizations. And then we can start thinking about how do we implement a plan to help them build that capacity.
Yeah.
We have to do that regardless of whether the federal funds flow or not.
Yeah, and definitely needs to be part of our strategic planning that I mentioned.
And that's what I'm saying.
Yeah.
I think as you do your strategic planning to put that as an item of discussion.
Definitely. Thank you for that. So I'll go to my slides, just kind of moving on. I will mention before that the MOU that I mentioned that we signed with the state of Minnesota, the categories that we can work under would be treatment support, which I mentioned, prevention support, so those harm reduction strategies that we have out there, and then other strategies, which you all mentioned, like with our police departments, first responders, our fire department, our hospitals and clinics, services like that. Exactly what you're talking about. So here's our little rough timeline that I just wanted to mention. And I do want to mention one of the partnerships that we will be exploring and trying to get a stronger partnership is with the Safe and Strong Communities Initiative. And that initiative is with the City of St. Paul, our Metro Transit, and our County Attorney's Office. And so I'm hopeful that we can get some inroads there too with public health being at the table. So really, I mentioned our coordinator will start here next month, if all goes well. And then we are going to work on hiring a few staff under this grant, which it's earmarked for some staff. Although I don't want to be staff heavy, I want to be getting this out into the communities because I think that's most important. We're going to obviously evaluate the effectiveness of those grants and try to draw some good practices from those. We will host the third Opioid Response Initiative Partnership meeting as part of our strategic planning. And then continue to be data-driven. We'll work with the data that we have and explore new data that's out there, and then really create an action plan off of that strategic plan going forward. So I have this kind of in the corner. This is not live yet, but we have a QR code that we've been working on also for people to take on their phone that will direct them to resources. That should go live here pretty quick. I don't have a date for you exactly, but I'll let you know. And this links directly to our website. It'll provide information on chemical and mental health related services, and then where to find booking reports for the adult correctional facility and our Ramsey County Correctional Facility, contact information for attorneys, and information related to court and other resources. So that was a partnership, an internal partnership that based on this. So that is the end of my presentation. You all had really good questions, and I have some homework to do.
Commissioner Singh.
I just want to thank the work that you're doing. I know that you're new to this, but you're representing work that's been ongoing from lots of staff and teams within the Public Health Department. And I also just want to say we've been talking about a lot of data, and we've been talking about dollars, but just for us to take a moment to remember all of the people that are behind all of that. These are our family members, these are our coworkers, these are our neighbors. There is hope for recovery, and we have to keep doing this work, so thank you.
Thank you.
So I too want to thank you for the work that you do, for joining the Ramsey County team, for leading. You have 25 plus years experience, you know, but you're new at this, right, in this role in leading. And I noticed that you're going to be hiring a new staff in the spring, and that takes some time. Probably take more time than we want it to take.
Yes.
And so, you know, your first slide said that we are in a national public health crisis. The number one cause of accidental death in the U.S. are drug overdoses. And Minnesota is no different than what we're seeing across the country. And so we are in an epidemic. There are, you know, you introduced some new information around 55 to 64 who are dying from that. Some of it probably is prescription drugs or maybe not, you know, but there's a real epidemic out there in the streets. And there's a lot of young people. There's a lot of Black, African Americans, Native Americans that we specifically said over and over again, who belongs to a family, who belong to a community, who belong. And so, you know, I'm just wondering, as you're hiring someone that could take up to 6 to 7 months, you got to train them, you know, they're new in the process. What do we do in the meantime?
We do have a deputy director that's looking over this work, and we just transitioned the work from kind of one division over to another division. That's and the division that this work is moving to is more connected to our clinical services, because they are like boots on the ground working in this. So yes, that does take time, but we're at the end of the process for having this person get in place. So when I say May, they'll be in place in May for the coordinator, but not for the positions under this coordinator. You're right, that will take time, but we're going to keep pushing our work ahead.
So in the meantime, you would have you have a process in place, you know, as in looking into the community grants that's going out in the community and what we want to see, the impact we want them to have. So that's happening. And so you have some initiatives, you have a plan for now.
Right.
To deal with the crisis that we're in at the moment, and looking at those community partners, you know, it's kind of like an all-in type of initiative that we're doing. And, you know, I am a true believer that this goes over many different service delivery areas, right? You don't have to do this by yourself, right? And so finding those key partners and building those relationships to have a greater impact, I think is really, really important now more than ever, because we're not going to get an abundance of money. And sometimes I'm like wondering, with all the money that we spent, what do we do with that? What do we get from that? You know?
The outcomes, right.
And so, because it's all about the outcomes at the end of the day. At the end of the day, you know, so my hope is that as we move forward, that we'll be more strategic, more creative, more innovative, let the data direct what we need to be doing, not just let the data direct what we need to be doing, and let this be a collective process, because we need that right now more than ever. And so that's, I think, in general, is my statement for Ramsey County, because there's a lot that's happening here in Ramsey County, right? And we don't have a big tax base. We can't always go to the people and tax them, right, to do this work. So it's going to really call for us to be very strategic around what we're doing, why we're doing it, and how we are doing it, and with whom we're doing it with. So thank you for taking on this challenge.
I would agree. To move the needle, we can't do this by ourselves. It's got to involve everybody.
Commissioner Strong?
Director, thank you so much for presenting to us and for modeling that, it's okay to take a step back, to pause and evaluate. I really appreciate that about this presentation, that, we are being honest with ourselves about, is what we created working and effective, and taking in feedback from community members. I also want to mention, though, that the priorities that we had focused on last year for the last grant round, I know that those were made very intentionally with community input as well, too. And so with only 1 year that has passed, I don't think much would have changed, right? Because we were really focused on, both pregnant and parenting families, because it impacts families. It just doesn't impact one individual, right? And then the culturally specific approaches for treatment and recovery, just meaning that it hits different ethnic communities differently, and or how they approach recovery. So those are just some of the examples that I want to lift up, that, I think that our priorities were still right within those areas. I think it's just a matter of evaluating whether our grant resulted in what we want to see happen too. So it's just really important for us to be clear about what we are measuring as well.
Mm-hmm. Mm-hmm.
Yeah, thank you.
Okay. Thank you so much. I know you've been here quite a bit in your short tenure, and you've taken a lot of comments.
Which
Thank you, Mary Jo. And you've done a good job, and I'm sure we'll be seeing more of you. So thank you for your good work. Ling, you wanted to?
Yeah, thanks, Dr. Karen. Appreciate your sharing today. I wanted to take a minute and invite Deputy County Manager Reyes up just to follow up. We just submitted a congressional earmark today related to opioids. So Gloria helped lead that work with County Attorney Choi's office in partnership with Amy. So I wanted Gloria to have the chance to share about that earmark request to all of you today before we wrap up.
Sure. Thank you, County Manager Becker, Chair, Commissioners. For the past, I would say, 6 months, we have been working with the County Attorney's Office, Metro Transit, St. Paul Police, and bringing in public health in this work, and devising a plan to do outreach and support law enforcement in the University Corridor on Metro Transit, and really deal with the opioid crisis. And we've been talking about this since I started last year, right? The earmark funds will support public health, community responders, community navigators, public health response, and being out there with law enforcement. For the past several years, we've been doing a lot of law enforcement approach, right, to arresting people, and it doesn't really solve. It's a part of the solution, but it's not the entire solution. And law enforcement is requesting support from public health, and we're going to bring in our appropriate response initiative, and we're working with Office of Neighborhood Safety in St. Paul, and we're trying this out this summer. We're going to be launching in May. But the earmark funds will help support this work moving forward.
Thank you for your good work, Lauren.
Yep. Thank you.
Thank you. Okay, legislative update, Madam Joe?
Yes, thank you, Mr. Chair. The third deadline was last Friday, so I know many people were at the Capitol finishing up that third deadline. The legislature is now on their spring break, so this whole week they will be out in their districts. So they will be observing the Passover and Easter holidays as well. So our government relations staff, and thanks again to all of them for all of their great work during this session, they wrote an extensive legislative update covering many of the provisions that are in the different omnibus bills, the big bills that came out by last Friday. And so I hope that all of you will read that. Our Association of Minnesota Counties also does a newsletter that comes out on Monday morning, and that's broken down by topic. So if you would read those reports, you'll get a sense of what was passed in the session. In short, there were still a lot of cuts and shifts in the areas of health and human services budgets that we will have to keep defending. So as the state and federal government are working on their budgets, they're passing more and more down onto the local level, which is us at the county. And so we are finding that we have a lot more work to do and less resources to do it. So we've been down there at the Capitol, testifying as to the impact of these cuts and shifts. And those conversations are going to be continuing as they are working on their conference committee and their resolution between the omnibus bills in the House and Senate. So just a couple of Ramsey County specific bills. Our EDA bill, our Economic Development Authority bill, was included in the Senate state local government omnibus bill, and so we're hoping that that stays in through conference committee. And we also have important extension language that's been included in the Senate Judiciary bill and in the Jobs and Workforce committees. So we've got some specific language that was included in one of the bills, and so I want to thank Commissioners Moran and Zhang for your continued work on those specific bills. So the tax bill and the bonding bill will be worked on after the break, as they did not have to, the deadline did not apply to those bills. There was a town hall this weekend with Congresswoman Betty McCollum and several of our state legislators. Our government relations staff attended. I know Commissioner Davidson can talk about it as well. They had a really full auditorium talking about the what's happening, the impacts of what's happening at the federal government. And just kind of I think a continuation of the rally from last week, as people are really speaking out on how they're really frustrated, upset by these things that are happening in Washington. So with that, Mr. Chair, that concludes my legislative report, and I would just ask my colleagues if they want to comment on anything either now or they can do it in their report.
The one question I have, when will we get a good, hard number, so to speak, on the federal government and the cuts? Because we got a plan. I mean,
right.
Town hall meetings and all of that is fine, but for us to do our work, we need to get a sense of where the cuts are coming.
Right, and of course you're asking the million-dollar question. I mean, all these cuts are really impacting the work that we do, and the proposed cuts are going to really impact our budgeting process. And everyone's feeling it, the whole country's feeling it, and we're letting Congress and the White House know that we have to have more certainty as we're budgeting, and it's not coming. But we're hoping, we're letting them know that we need it as fast as we can. But unfortunately, the reality is that this White House, quite frankly, is not doing things in an orderly manner and doing things not without a lot of, I'll just editorialize, not without a lot of thought or certainly consideration of what they're doing to the people that we represent. So we are, NACO, as our National Association of Counties, is working tirelessly to let the departments and the White House know about the proposed cuts and about, as we've been talking about, Medicare, Medicaid, and the cuts that they're thinking about doing, and how that would severely impact our work. And so we don't know when those numbers are going to come out. I would just encourage all of us. There's NACO does 100-day, it's over 100 days now, but they do a membership series where they're talking about the things that are happening at the federal government and how they're impacting counties. And we're hoping to get a better sense. I mean, every day we hope to get more information, but we'll keep you posted. If we get information, we'll let you know. But I think what we're all finding is that it's hard to rely on what they're doing at the federal government. So we're almost on our own, which is really scary. And I don't know if the county manager has any more information on that, but it's really detrimental and tragic to the work that we do.
You want me to do county connections? Okay, thank you, Mr. Chair. So to back off of that, I think while we can't control what we don't know, what we can do is to be more, I call it just kind of shovel ready, or be more prepared for whatever comes our way. And so we have a lot of teams working together right now, trying to understand our grant exposure, how our human resources and our personnel are connected to those grants. And I would anticipate in the next week or two, we can come back to the board and share a little bit about that work, so you can kind of see some of that framework that we're building to be ready. In terms of other county connections this morning, related to the National Public Safety Telecommunicators Week, I thought it was a good week to highlight that 2 ECC employees were actually recognized at the Minnesota Sheriff's Association conference last week for their outstanding service. This is statewide recognition. Erin Hutton, who's a communications training officer, she was the communication training officer of the year, logging over 1,000 hours of training and mentoring of new staff. And so that's wonderful for her. And then Jen Schmidt, who is a ECC support person of the year for supporting the operations of the 911 center during that major remodel. I also want to thank that team. I recently brought the city administrators from throughout Ramsey County for a tour, and they did a really great job talking a lot about their work for those folks. So a few weeks ago, I shared about some of our staff who've been selected as part of the Young Leaders program at the University of Minnesota. And I wanted to share that also Library Director Peng Yang was also named to this year's cohort. She was a later addition, and so I wanted to make sure to recognize her. She will be joining Bobby Joe Potter as well as Rose Lindsay representing Ramsey County this year. And then it is my pleasure at this moment to show, I brought the trophy home for everybody. Here's the winnings from the Northland Cup. Here's we won the stick. So Shelley, if you want to come on up. We had a great opportunity to celebrate the work of St. Paul Ramsey County Domestic Abuse Intervention Project, SPIP. It's a nonprofit organization. Shelley Klein, executive director, is here. The county and the city played a hard-fought hockey game, and really proud that we won 6-3. But the real winners are the 6,200 victims that and their children who receive free crisis intervention, transitional services from your organization every year. Shelley, thank you so much for your work. I do have to give a shout out to our coaches, which were Commissioner Miller, Sheriff Bob Fletcher, and Chris Tolbert, who was a city council member, switched over sides and played on behalf of the county, now as a county employee, and he took home the MVP. So a lot of exciting news, but thank you. And I'm sure commissioners want to say something, but we'd love for you to just offer any remarks this morning, Shelley.
Well, thank you for inviting us here. Commissioner Chair, commissioners, and the manager. It's all of you who have stood by this agency and our work for decades and decades. 24 hours a day, 7 days a week. We reach out to victims after an assault in the hospital, horrendous situations with multicultural, multilingual, responsive services. We go through the court system. We provide attorney support. We get people in housing, counseling. We talk about opioid addiction. We're working with so many young women being trafficked with those addiction issues. We work hand in hand with our public health. 911 communications sends out those calls to us immediately. All of the above. I want to add something too. Sadly, in 2024, in the state of Minnesota, we had 24 domestic homicides, 4 of which were in Ramsey County. 18 months ago, our agency, with our county partners and our city partners, started a domestic violence homicide prevention team where we looked every month at the very highly lethal cases. In that 18 months, we have seen a significant reduction in domestic homicides. That's one example of our agency working with our county partners and city partners for a holistic response to end domestic violence, and everybody sitting at these tables is a part of it. Often tell victims, we hear so many times, they said, SPIP saved our lives. We wouldn't be here today if it wasn't for your agency. And when I get the opportunity, I tell them, thank you. You see us here. It's an honor to serve you. But there are so many people you don't see that are lined up behind you to make sure you and your children are safe. And so that's all of you. Thank you so much.
Thank you.
Well, I just want to say before I turn to the board, I think I met Shelley. I came here for grad school in '79. I think I met her within that first
Early
year.
80s.
It was
when we were at CASA.
Yes, when you were at CASA. And Shelley has always been a champion of this issue. I never. That's when I think of this issue, I think of you. You're the picture in my head.
That's an honor.
You've been a great champion and a great educator because you've educated people like me. And I just want to say thank you. And I don't know, every year I look forward to seeing you because you are so important to this work in Ramsey County. And so thank you for everything you've done.
Thank you so much.
Yeah, thank you, Mr. Chair. I have a lot of notes I wanted to comment on how amazing you are and the work that you and your organization does, and just the energy that was in the arena at the time because of all of the supporters that were there, the sponsors that were there. We have actually a sponsor in the chambers here, Alec Wands from Ready Rebound, who awarded the MVP award, is here with us now. But we couldn't do this work without the sponsors and the people that donated, because the whole purpose of this event is fundraising for the great work that you do. And we had great intergovernmental support from David Pinto, who sang the national anthem, our legislator, and then Leon Lilly, our state representative, was a referee. And John Harrington, our own former chief of police and legislator, is our King Boreas, and so the entire royal family was there. And I want to give a shout out to Tessa Westland, who's Aurora, Queen of the Snows, who's actually from Roseville. But they had the whole entire Winter Carnival family was there to participate, and it was just an amazing event to have all the supporters and the great silent auction. I mean, all the people that gave and donated their time and their resources. I want to thank Kathleen Murphy, who of course did so much work, and Darren Tolbert was still there, Joanne from previous years. I mean, there's so many people that participated in this great event. And just thank you, Shelley, for being the face of this amazing work that we all unfortunately need to support, but we really want to support. So thank you for everything, and thanks to everyone who really helped make this event just an amazing event.
Thank you, Commissioner. I have to say that this year we raised $26,000, and a lot of the money issues that you've been talking about certainly have been hitting home for our organization and many others like ours, domestic violence and sexual assault across our state. So that was a record amount. And it's also a time that our partners come together, we work together, and it's this collective voice that nobody can abuse any member of our community, and none of us will stand for it. And you could feel that collective strength and joy for the work we do at our hockey game, and it was amazing. Thank you.
Yeah, and thanks to all the players. I forgot to mention all the great players. So we had many in Ramsey County and well, obviously they were all Ramsey County and St. Paul employees. So
thank you so much.
Yeah.
Thank you, Shelley. Let's move on to our, who should we begin with? I'm trying to remember. Let's bring with you, Commissioner Singh.
Righty. Well, every week is a busy week. Last week I was able to attend the Mounds View Partners for Education Breakfast. This is an event to support Mounds View area schools, and I just want to say that there was a truly inspiring keynote speaker. She was an Irondale alumna, Alicia Dunnigan from 2011. She is now an educator in Mounds View and is pursuing her PhD. It was just lovely to hear her story. It's just a reminder of how important healthy adults and adults who take an interest in our youth at critical times can really change the trajectory, not only for those individuals, but what a wonderful capacity building for our own community to have this bright young mind now coming back and serving in the very community that she grew up in. I was able to attend the CERT Connect open house, and this was a program. The CERT program is a directory for small businesses in the small business community, and it's a way that we connect and share with Hennepin County, Minneapolis, and St. Paul, and how we collectively work to get bids and to do outreach into community. I know I'm just handing this. I know Catrice was there. We got to walk through. It was wonderful for me to be able to meet a number of our county departments who work directly with our construction and our contractors and business community and talk to them and get a sense of the work that they do. But also to had a chance to talk with some of our municipal partners who were there, Ryan Companies, who was working on the Rice Creek Commons Outlot project, and some of the other just contractors and workforce folks. And in that space, what's nice is we were able to chat about workforce innovations, the next CEO, some of our career pathways programs. So while that wasn't the specific reason why we were there, it's a wonderful opportunity to talk about the different intersecting ways that the county is doing this work. I was at the Northeast Youth and Family Center, Youth and Family Services Open House. So this is an organization I used to be a part of. They had a open house lifting up their Community Connections program, which is part of their diversion program, but also an extension. So it's a way of talking about those healthy adult connections. It takes youth and their parents through different leadership opportunities, connecting them directly into their communities. So it's getting them into the libraries, it's getting them into service opportunities, it's allowing them to do personal and professional development and to practice some of those leadership skills. And so it was wonderful to be back in home territory. And I really want to lift up, again, this is Sexual Assault Awareness Month, and NYFS, along with a SPEP we just talked about, the Sexual Violence Services, the St. Paul Intervention Project, those are two of many of the partners that the Sexual Violence Services of Ramsey County works with. So I just want to also say here are some others. I'm sure there are many others, but Face to Face, St. Paul Intervention Project, CLUES, Hmong American Partnership, Women's Initiative for Self-Empowerment, Transforming Generations, Community University Healthcare Center, the Asian Indian Family Wellness Center, ARC, and Standpoint, and many others. So just lifting up that, as we've been talking about, we don't do this work in isolation. And I want to talk about in suburban Ramsey County, NYFS has a new Restoring Power program that supports victims and survivors who experienced a range of abusive behaviors from others, including emotional, psychological, physical, technological, and sexual violence. So there's a lot of new services that have been just available within the last year or so at NYFS. And so I encourage folks who are looking for supports in that area that is a suburban provider in our district. Similarly, as we're talking about all the different ways that we meet people where they're at, I had the honor of attending the 20th anniversary of our mental health and DWI courts. From the Minnesota Judicial Branch, this is a quote talking about treatment courts are the single most successful intervention in our nation's history for leading people living with substance use and mental health disorders out of the justice system and into the lives of recovery and stability. They improve education, employment, housing, and financial stability and promote family reunification. Instead of viewing addiction as a moral failing, they view it as a disease. Instead of punishment, they offer treatment. Instead of indifference, they show compassion. And it was wonderful to be in that space and to see all of the dedicated judges and county and city attorneys that are working that, the supporters, and most importantly, those who have been impacted and lifted up by this alternative to our traditional court system. I've also been work with the Association of Minnesota Counties Behavioral Transformation Group continues. This week we were talking about different barriers and root causes for folks to access mental health services such as transportation technology, cost of services, complexity of services, lack of services. So we're really doing a deeper dive. We're also looking at the different initiatives that are like this that have been happening around Minnesota, so from different sectors, so that we're not doing duplicative work, so this is additive. I, along with Commissioner Miller and Commissioner McGuire, were at the breakfast with Friends of the Library. The author Mona Susan Power discussed her book, Council of the Dolls, and I'll leave a little bit that more for Commissioner Miller to talk about, but I wanted to lift up that Deputy Director Ray Lockman spoke, talking about books as mirrors and windows and sliding doors, and they help us build understanding, empathy, and having the power to transform our views on the world and each other. I think that given in this time where so many of our community members are being vilified and dehumanized and othered, that our libraries are such a wonderful public space for us to break through that and to continue to build community and learn more about each other and to build that sense of empathy. There was an activist event in Vadnais Heights in my district. It was great to see constituents out hitting the streets, voicing their concerns and bringing awareness about the changes. And also I was at the town hall that Mary Jo had, or that Commissioner McGuire had brought up. I will say the calls that we are hearing, and we hear you, from folks who are from our disabilities community, from our elders community, from young families, and on. We hear you loud and clear. We are standing next to you and doing what we can in our capacity to fight and mitigate the changes that are coming. I want to say on a little bit more of a personal note, when your adult children say, "Mom, I got tickets to whatever event," you learn just to say yes. I found myself in Minneapolis last week for a Bill Murray concert. Yes, he had a band. And the reason why I bring this up in this space, though, is that it also was the AC/DC concert night. It took us an hour to get out of town, and all I could think of is, why aren't they in Ramsey County? And so if there's any way, as we consider our economic development and our entertainment and our other venue dollars, I kept thinking, and you could be in Ramsey County. And so wanting to figure out how we can lift that up. I also had a chance on Sunday over the weekend to have a Passover Seder, a family event. And it's wonderful to be able to sit in community and have discussions around things and to lift up communities who are celebrating Passover and Easter celebrations this week.
Great.
There you go.
Oh, this way. There's no certainty in this. There's no consistency in this order. I guess you just go whatever. Yeah, thanks.
Gotta be ready.
Thanks, Mr. Chair. We don't. Yeah.
This is basic training.
I love it. Yeah, just be ready whenever. Okay, thank you, Mr. Chair. I'm always ready. That's okay. I am always ready. I just am curious about that. Okay, so last week. There was the Climate Action Working Group for the Ramsey County League of Local Governments met. We heard from the Rice Creek Watershed. They have a climate resiliency and flood reduction efforts. Of course, that's their goal. And it was a great presentation from them. So just shout out to the work of the watershed districts that are in our county and the work of the Climate Action team with the Ramsey County League of Local Governments. Also, the Ramsey County League met in their monthly meeting, and we heard from Dr. Rose Chu, who's actually a school board member in Roseville, a Little Canada resident, and she's the founder of Elevate Teaching and is a board member, as I said, of Roseville Area Schools. But Elevate Teaching is just an amazing, effort, of course, to really celebrate and recognize the profound impact that teachers have in our society and to really elevate that profession. We know that teaching is crucial in the lives of all of us and all of our young children. And so we just, it was a great awareness of the importance of that teaching profession. So that was a great conversation with the Ramsey County League of Local Governments. Then the Library Friends breakfast was just such a joy to be in a full room with probably over 100 people there. Shout out to the board of the Friends of the Library board, who really puts these events on and really participates in, contributing. They raise money for the collection. And so it really improves the collection in all of our Ramsey County libraries. And as we know, they are some of the most visited libraries in the state. And so people from all over the county use these libraries. So just shout out to the Ramsey County Friends and the people that put that together. And of course, the author, Mona Susan Power, who's a Ramsey County resident, and I'm hoping that Commissioner Miller will say more about her, but she was phenomenal. And it's so great to have such great gifts of authors in our own county here. We have a lot of really amazing authors here. Then also we talked about the Northland Cup, which was just a great event. The NACO did their membership series. Just want to keep encouraging you all to listen to that. It is an update on what's going on nationally and how it's impacting counties. And it's just a half an hour update. It's on virtual, and you can sign up for that from our National Association of Counties. This Thursday, in a few days, the Solid Waste Work Group for AMC will be meeting, and we're excited about that. And then I think, and then the AMC Board of Directors is going to meet. I also want to say that we, last Friday, while the League of Local Governments meeting was going on, the Climate Smart Municipalities group was meeting. This is a group that comes out of the University of Minnesota, and our own Trista Martinson spoke, and she gave a presentation on household organics and the work that we're doing at the Recycling and Energy Center. So that was a statewide meeting that she presented at, and so just everybody's recognizing the work that we're doing with our recycling and energy and our organics collection system. So with that, I want to just add my final comment is I appreciate Commissioner Jabin Singh and her, comments about how we hear people. We hear you. People come up to me all the time. What can we do? What can we do? I said, yes, you can keep letting us know and keep sending stories to our elected officials at the state and federal level. Let them know how this is impacting your lives. So when you have a family member, a friend, anybody you know that's impacted by this, they want to know what the reality is out in the public. And so send those stories to your local elected officials, and please copy us on them, because we want to elevate and expand and really give voice to your stories, so to your lives that you're living. Thank you.
Jen?
Thank you, Mr. Chair. I will need to just pull up my notes here quickly. So last week, Commissioner Moran and we met with the House Chair of Government Finance Committee, Jenny Claiborne, about our EDA bill, and it sounded promising that it would be considered. So we hope that it will make it through the cycle for our economic development bill. Second, we attended. Commissioner Moran and I both attended the St. Paul Children's Collaborative. We selected grant reviewers to join the committee to review grants from community organizations who serve both youth and families. These are 2-year grants. So the the grant will open up later in June, I believe. And then number 3, I attended the CAPRW's executive committee meeting, and we discussed about just like potential cuts that we are also hearing that would really impact not just CAPRW, but really our entire community. There are potential cuts of both Head Start, that's the early childhood program, as well as the low-income heating and energy assistance program. Those are all things that are being reported from the President Trump's administration's budget. So although it's a draft proposal, we do have national associations that are also tracking that and actively working to tell our story about its impact to our communities. We also know that there has always been strong bipartisan support for both programs. So what we'll do, and the message again to all staff and residents who rely on it, is just that, we will continue to operate our Head Start and LIHEAP programs as normal. We'll continue to request for all the funding that's possible, and that, these national organizations that we are also a part of, which is National Energy and Utility Affordability Coalition, National Head Start Association, the Minnesota Head Start Association, Minnesota Community Action Partnership, National Community Action Partnership, and the National Community Action Foundation to stay abreast of any changes. And finally, the message again is just we remain committed to supporting our families during these times, and that again, this is a proposal, and that it still has to go through Congress as well to get approved. So again, sharing our stories, speaking up about the importance of these programs will go a long ways. And then finally, I want to give a shout out to John O'Phelan and Director Catrice O'Neill for putting on the 4th annual CERT event. Although I wasn't able to attend, I was able to connect developers from the Heights project to attend and be a table there too. CERT is a program, is a directory of like small businesses and small community members who are certified through that process, so that both the county, Ramsey County, Hennepin County, Minneapolis, City of St. Paul utilize to find and to bid out projects to small women and minority-owned businesses. And we also collect and track the county's business contracting data. So it allows us to see how we are doing, where we can grow and improve, and get businesses connected to contracting opportunities. So out of that event, this is the 4th annual CERT event. 140 plus small businesses registered, 91 attended. This is the largest annual event to date. And we also hope to continue to encourage more cities to participate as well, because cities also have a lot of contracting opportunities that rely on these businesses as well. So that's the goal for the next event, is inviting more of our cities within Ramsey County to also attend and to also meet some of the businesses here. And then finally, County Manager Becker and I will be attending the Hmong National Development Conference. This is a large conference convening of all organizations that serve the Hmong immigrants and Hmong population across the United States. It's just also a place to share and exchange, best practices, learning, and also research. It's a very large event, so they are completely sold out. I couldn't get any more additional even tickets to some of the events. So we are presenting a community proclamation, and since we'll be presenting it there, I'll read it here for us that you all had also signed on.
Oh, Okay, I just say we're 15 minutes behind.
Oh, we are. Okay.
So
I will.
you gave me 3 finalists.
Oh.
So I let you go, but
I'm sorry.
Give us
Yes.
Yeah.
I'll read through it quickly. How about that? Whereas 2025 marks 50 years since Hmong migration to the United States and the 20th Hmong National Development Conference, the largest national convening of Hmong American leaders. And whereas this year's conference theme, We Rise United, which is held in Minnesota, offers dynamic workshops, critical dialogue, networking events, an awards banquet, and cultural performances to commemorate the history and progress of the Hmong American community. And whereas over 1,500 participants from across the nation will come together to engage in discussion, share strategies, and explore bold and innovative solutions in areas such as business, civic engagement, social justice, health equity, education, and leadership development. And whereas Ramsey County reflects on the courageous journey of Hmong families who resettled here as refugees following the secret war in Laos, and who for half a century have preserved their resilience with hope, and establishing what is now the largest Hmong community in the United States with over 95,000 residents living in Ramsey County today. And whereas Ramsey County honors 5 decades of remarkable contributions of Hmong Americans across all sectors, as reflected in HNDCs, including academia, law, public service, private enterprise, healthcare, the arts, community organizing, and more, demonstrating excellence in broadening the path toward a future that once seemed distant for generations past. And whereas Ramsey County remains steadfast in its commitment to supporting the prosperity of all residents, including the thousands of Hmong American families currently impacted by poverty, through delivering culturally responsive and equitable access to social services, community resources, and opportunities that foster inclusion, stability, and generational wealth. Now, therefore, be it proclaimed, the Ramsey County Board of Commissioners declares April 17th as the day of the 20th Hmong National Development Conference in honor of its enduring commitment to building a more prosperous and united future. May this gathering continue to challenge, inspire, and uplift as together we rise united. Thank you.
Thank you. I'm going to ask this side of the table to make it shorter, and we'll make up for it next week. You can have double the time of that side of the room, okay? We're putting you behind the 8 ball, Kelly, with the workshop,
Oh, okay.
because now you're literally going to have about a half hour less. So just be aware of that. And we're going to try, all of us, to make sure, help you out and hold our questions until you get through the workshop, okay?
And I can hold until next week to do mine.
It's up to
It's
you,
fine.
Garrison. I'll just go ahead, Rena.
So I just do one, and I will speak about the Neighborhood Safety Council, Community Council, who hosted a HERD discussion, which was a conversation to discuss the Rondo Community Library and its perimeter. I must say that I do feel sad sometimes that I do not have a county library. Okay, but I do have what is right there on my block in the community, which is the Rondo community. But the conversation allowed a better understanding of what is working, our public safety efforts, and what we can do to refine our processes to enhance the library experience for constituents. So HERD stands for Hearing Everyone Attentively, Respectfully, and Diligently. And so as part of the Office of Neighborhood Safety, the Neighborhood Safety Community Council is a group of community members representing the 7 wards of St. Paul that work as a council to strategically identify, recommend, and prioritize public safety initiative. And this is to help establish areas of focus and assist departments in their efforts to monitor justice, safety, violence prevention metrics and indicators. There has been this has been very hard work to build and rebuild relationship and trust, working on public safety alternatives and preventative measures through community engagement. And so you have like the City of St. Paul at the table, Metro Transit, community-based organizations, residents, St. Paul Police, Trusted Messengers, all come together to really look at, from the train to the platform to the communities, and what is happening around homelessness, opioid epidemic that we see happening in our community, and the impact that it's also having on the Rondo Library, who sits on the corner of University and Dale, where there's a lot of traffic, right? But I really must say that there has been such really great work and efforts to do the work, right? Bringing partners together with solutions, and doing it in partnership with like community and the city, Metro Transit, St. Paul Police. Realizing that we cannot police our work out of this. It's not about arresting a lot of the youth and others who are hanging around and out about, but what can we do about controlling or bringing solutions to the table around the opioid epidemic and the impact it's having on community. And so they have just taken it. I mean, we're not where we need to be right there. The Rondo Library has brought on more security from the community to welcome and respect all, regardless of who they are and how they may look or may be dealing with, but to also ensure that staff is feeling safe and those who are coming in to utilize the space are feeling safe and they're able to utilize the space that is really, really needed in the Rondo community. So very good conversation, good plans put together, and the action is happening. And I'll stop there.
Thank you.
I can wait till next week.
And I'll wait till next week also. We have a workshop that's going to be chaired by Kelly Miller, Commissioner Miller. We'll take 5 minutes, and just so everybody could get down there and take a break. And then this afternoon, we have a 1:30. Commissioner Moran, you're chairing that workshop. Okay, we are adjourned. Thank you.
I don't know, maybe. No.